So prepare to enter the stress-free zone when our guest gives you pointers on how to make life a tad bit easier. Instagram, we're bringing the professional community to you. We got you. There's a topic, a professional you want to hear from, let me know. I am Liz, the brain-based therapist. I am your host tonight, and we welcome Dr. Sean Gimbert. He is a chiropractic physician at New Spring Chiropractic, and he's here to share his professional insight with us. You are in for a treat. So thank you so much for joining us, Dr. Gimbert. We're excited to have you and to hear what you brought for us tonight. Tell us a little bit about you and what you do at New Spring Chiropractic.
So at New Spring Chiropractic, we really try to take a whole person approach. So my wife and I are both chiropractors, and we've been in the Flagler area for over 3 years now. And I think we've known each other for almost 3 years. So
that's correct.
To be able to get to know you and to just help make Flagler a healthier place. So I can give you a little bit of background on kind of what we do, what we focus on. In my opinion, I'm coming from my home command center here, and what I deal with, I think there's three main areas of health. Okay, we've of course got our physical aspect. Okay, we've got chemical health, body chemistry, as well as emotional or mental health. And if we don't keep all of those in check, we're going to have problems. Would you agree?
Yes, and I think our viewers would benefit from hearing a little bit about what that would look like. Like, how would they know they need to see someone?
Sure. Well, with chiropractic, how many areas do you think out of the three that we're going to be dealing with mainly? What do you think, Liz?
In chiropractic, I would say all three because of the balanced approach.
Yes.
So, yeah, if any of our viewers want to guess, you're welcome to do that. But that's what I would guess. We're always going for that balance.
Yeah, so you're exactly right. We deal with all three with chiropractic care. And how it works with chiropractic is like this. We've got our brain, okay? And we've got our spinal cord, okay? And that makes up our central nerve system, okay? And then we've got, from the brain, millions and millions of nerves going out to every cell, tissue, and organ in our body, okay? And in order to have optimal health, first of all, we have to start with optimal body chemistry. Our bodies are going through millions and millions of chemical reactions every single minute, and unless they are functioning at the proper level, all of the organs, tissues, and cells are going to suffer.
Right.
And a lot of people are familiar with the physical aspect of chiropractic, but it also deals with the chemical health of our bodies. Because we know that we have to have 100% of our nerve information coming from the brain going down to every single organ, tissue, and cell of our body. Okay, if we only have, say, 80% going to our lungs, right, a kid might develop asthma. Or if we've got 75% going to our heart, it might not show up for years and years, but eventually the heart is going to become diseased. It's not going to work as well. We can develop things like an arrhythmia or have congestive heart failure. And those don't really show up as symptoms.
Right.
Most people don't know that they're having heart problems until they either get it checked out or they have a heart attack.
Right.
It's essential that the nerve flow to and from the brain is maintained. And on the third leg, we also have that emotional connection of health. And the big way that chiropractic can influence our mental attitude, our mental health, is through the influence of balancing the chemicals in our body a big part being hormones.
Right.
So when we're able to realign the spine, we actually have a direct effect on the brain, which helps to regulate the neurohormones that are produced. And I'm just going to talk real quick about three of them, if
Yes, yes. I'm like, to me, that's beautiful because I love, talking about the brains and the hormones. Normally people are not in tune with how important these neurochemicals are within us and how they show in areas like you mentioned, mood and emotion. And I really like that you, in your practice, are noticing this and educating your patients on it. That is wonderful.
It's huge, especially in this day and age. Balancing that emotional aspect of our health is key. The first thing that chiropractic can help balance is the hormone serotonin. So serotonin is the sleep hormone. Okay, it helps us get relaxed at night. It helps us to have a better sleep. It helps our brain to be able to heal and recharge itself as we're sleeping. A lot of people turn to some type of help from outside serotonin, but this is the natural way that it can be balanced. The second thing is dopamine. So dopamine is actually what's considered to be the attention hormone. And if we have problems with dopamine, kids, if we're talking about kids, they're going to have problems paying attention in school. And a lot of times they can eventually be diagnosed with something like ADD, ADHD, and they might start having bad grades. They might start getting bad grades because they literally don't have the hormones that's necessary to pay attention anymore in school.
I love that you mentioned that because, usually when people or parents see attention issues or focus, they immediately go to ADD or ADHD, which is not always the case. So it's important to be going to practitioners that are educating you on what you need to be aware of, what you need to keep your eye on.